a good time to go ahead and take the kids out of the room. Today we are talking about sex after you have a baby with Dr. Irwin Goldstein and physical therapy director Debbie Cohen. Both are from the San Diego Sexual Medicine Alvarado Hospital. Thank you both for being here.
Thank you.
Okay, we were just talking a second ago, and the statistics you're giving me are fascinating. 4 million women in America have babies every year. 25% of them have pain after having a baby. Can you talk, Dr. Goldstein, a little bit about what kind of ramifications women are seeing, specifically in their pelvic, after having a child?
So Erica, first of all, Happy New Year, and thank you for doing this. So this is the pelvis, and there are joints at the symphysis area and joints at the sacroiliac area, right and left. So these joints are under great stress as the pelvis expands, and in some people, these pains persist, 25%, so it's 1 million women have pains. You know, doctors say 6 weeks, everything should be fine, go back and having your sex life again. But that's not true in a quarter of the people.
Debbie, how do you know what is normal pain, just getting back to normal, and what is, okay, I've got a problem, I need to do something about this?
Well, any pain is problematic, and it's very common to have pain during pregnancy and afterward because of the hormones in the body that make all joints more flexible. But if it persists after 6 weeks, it's really something that needs to be addressed and can be addressed at any time by a physical therapist.
And what do we need to do about this? What can we do about this?
So we have women coming to us with sexual health issues. This is why the sexual medicine issue. And it's not always about pills or hormones or sex therapy. And this is where we get into physical therapy. So this is a lesson that you know, pelvic floor physical therapy is really important in the sexual health world.
And what types of things can you do to try to fix this?
Well, basically a physical therapist will help to isolate the weaknesses, especially in the abdominal muscles and pelvic floor muscles, which normally stabilize the pelvis. And another very useful thing might be to wear what's called a sacroiliac support belt.
Okay.
This goes around the pelvis and basically stabilizes the joints of the pelvis to make them less painful and mobile.
It seems obvious, Dr. Goldstein, but this, I would imagine, is impeding a lot of people, you know, keeping them from having sex, basically, because it hurts.
It's hard to get in position. It's hard to roll over. It's hard to, you know,
all the above.
All the above, yeah. So, and we don't want that to happen. We want everybody to be happy. So, you know, we'll do a full examination on them. We'll check their hormones. We'll do the physical examination. But at the end of the day, muscle health, joint health, musculoskeletal health is really important, and the multidisciplinary approach is really the critical issue. So Debbie does fabulous work, and you know, they can avoid surgeries that are unnecessary. Urine leakage is a common thing, and we don't want that either. So she can work on the urine leakage issues.
What kind of things have you heard from patients? Can sexual function be fully restored after people work on some of these issues?
Yes, absolutely. It can be fully restored, but you should catch it early. And it also has to do with activities of daily living and child care, all kinds of things. So all this really can be taken care of. It's not something to ignore because you think it's just part of being a mom.
Right. What's the bottom line? What's the takeaway for folks that are watching this right now that might be 6 or 8 months out from having a baby and still experiencing some pain?
Basically, take care of yourself so that you can take care of your baby, and so this won't go on. It's not something to just deal with. Pain can be helped.
Debbie, thank you so much for being here.
Thank
Dr.
you.
Goldstein, thank you.
As
Really
always.
appreciate it. If
Happy
you'd like
New
to,
Year.
Happy New Year to both of you. If you'd like to get more information or get in touch with Dr. Goldstein at San Diego Sexual Medicine at Alvarado Hospital, all you have to do is go to our website, fox5sandiego.com, click on that Scene on tab. Okay, Raul, back over to you.
Can the kids come back in the room now?
You can come back, yeah.
Can I come back in the room now?
No, you're still out.
I'm still out. Thanks, guys. Appreciate it.